Okay.
Good afternoon. I'm Chris Steinmetz from the Autism Society of Iowa, and I would like to welcome all of you to the Lunch and Learn today on dental care entitled Smiles for All, Effective Oral Care for Individuals with Special Health Care Needs with Dr. Marchini. Dr. Marchini is going to take questions at the end of his presentation. So if you have a question, please put it in the Q&A during the Lunch and Learn, and he will address those at the end. Our presenter today is Dr. Marchini, who is a professor and the chair of the Department of Preventive and Community Dentistry at the University of Iowa College of Dentistry. His research focuses on factors affecting geriatric oral diseases, conditions, and dental treatments, patient satisfaction with dental care, and the best way to teach dentistry. He has received 20 external grants, published 7 textbooks, 20 book chapters, and over 200 peer-reviewed articles, resulting in 1,790 citations and an H-index of 25. He's an editorial board member for the Special Care in Dentistry Journal, Journal of Prosthodontics and Brazilian Dental Science Journal, and the immediate past president of the Special Care Dentistry Association. Thank you to Dr. Marchini for being here today.
Thank you. Thank you for the nice introduction, Chris. This is awesome. There's one thing on that bio that I think is worth noting. I am married to Adriana, and I have 2 kids, Daniel and Gabriel. Daniel is 22, and he's finishing his undergrad students here at the University of Iowa and graduating in May. And Gabriel has 15. And he has autism that was diagnosed when he was 6. So it was kind of a late diagnosis. And we had a very, very interesting journey with Gabriel. Gabriel will probably not be independent as an adult. So we will be, we are planning to have him forever in our house. So that also informs me about the needs and and barriers and enablers that surround caring for a person with special healthcare needs. Now, Gabriel is currently, a teenager, but looks like a small kid. He is small and easy to go at the moment. He had his days of more aggressive behavior. Now he's doing much better on that. We have a better medication. We finally found the right match as far as physician for him, and we are at the moment having everything under control. We live in Iowa City. Iowa City is a town that has a lot of resources and all that, and people are nice, and we have great special education. But we are afraid about the future, right? As he become an adult and school will not be there, and then what would be the resources and all that. So those struggles are not at all unfamiliar. It is quite familiar. So we will talk a little bit about those. Fortunately, we are not facing oral health problems. He has been seen by pediatric dentistry here at the University of Iowa College of Dentistry. Actually, the chair of pediatric is Brazilian as well. I'm from Brazil, by the way, as the whole family. That played a little bit on his late diagnosis because, when he came, he was 3, and we moved to a different place with different culture, different language, and a lot of his behavioral issues were more, we were, kind of considering that it was part of his adaptation process. So yeah, that's part of my of my education in how to treat people with special healthcare needs. So today we're gonna focus on two different heads of this problem. The first head we're gonna tackle is, how to access and how to get appropriate oral health care for people with special healthcare needs. And in this, and the second half of it, we're going to talk a little bit about how to provide oral hygiene routines in an effective manner to people with special healthcare needs to try to keep them out of trouble as much as we can as families. Okay. I hope this sounds like a plan for you guys. And of course, if it will not have time to cover everything, but I will be more than happy to answer questions and be in contact with any of you after this presentation. The very last slide will have my email. You guys can um, take note of it, or it's very easy to find me in the internet. It's just going to University of Iowa College of Dentistry, Department of Preventive and Community Dentistry, and you're gonna find me pretty quickly. So I think we should move on now to the next slide. Let me see, where is it? Here it is. Okay, so you know when we are talking about people with special healthcare needs, we are usually talking about a person that has a primary diagnosis that is kind of the main issue surrounding the person, and that then that core issue brings a lot of different sub issues, right? You have a lot of those different appendices that comes with it. So usually say a person with autism will have attention deficit and hyperactivity disorder, or may have depression, or may have anxiety, or may have aggressive behavior, or may have this or that, or need speech pathology, need um, uh, um, psychologists, need um, a developmental disability doctor, may need a nurse. Well, you got the idea. We need an interdisciplinary team. So it would be great if that interdisciplinary team sit around a table like this group here. Here you have every specialty under the sun. I mean, a nutritionist, physiotherapist, speech therapist, nurses, psychologists, primary care physicians, administrators, social workers. You have all the groups sitting around one table, and that was in a hospital that I was working back home in Brazil that was specialized in frail older adults. So every Friday we will sit around the table during lunch hour, and we're going to discuss, and we discussed every single patient case from start to finish, um, all that happened during that week and what was the plan for next week. Right. That is awesome, but that's very expensive, right? That was a very elite type of hospital that provided that type of care. That's not reality in many places around the globe, and we are no exception here. So it's very difficult to coordinate the care and get a lot of people to talk and get involved. So it would be important if we have a few keystones during the treatment or during the diagnosis or during follow-up that people remember to talk to each other, right? So, well, what are you talking about, Leo? I don't understand what you're saying. Well, say when we got our diagnosis, right? We got the autism diagnosis at the CDD here in Iowa. Great, great resource and all that. And then a social worker worked with us to get, Medicaid, to get a Medicaid waiver, to do this, do that, find, they have a psychology group there that would work on behavioral therapy with us and all that. That was all great. But at the time, nobody talked about dental. Well, that might be because we were dentists, so they have not thought about that being a problem. But if if it was a lay family, they should have also provided instructions about how to find a dentist, where to find a dentist that would take care of Gabriel, and what would be them oral hygiene routines and prevention, and come up with a preventive dental plan, right? A dentist that would be able to do that and look at his special needs and come up with a plan that fits his needs. Or if people come, you know, to a regular routine appointment with the physician who is taking care of the primary diagnosis, if the physician would just ask those 4 questions, right? Is there anything bothering you in your mouth? Do you feel your mouth dry? Do you have natural teeth, dentures, or both? This is usually for people, for persons who are adults or even older adults. And then, did you have a dental visit in the past 12 months? Those 4 questions can cover most of the usual problems that we see among this population. And if we follow a very simple algorithm of what to do if it is yes to that question and what to do if it's no, the physician would be able to either do an oral health assessment themselves if they want to, or refer to a dentist, right? That would be easy to do, quick to do, especially if this physician has access to a list of referrals in their area. So we have been working to put it together for persons who have special healthcare needs and frail older adults, at least in Iowa. So physicians will be able to, follow this algorithm or have it on their electronic health records. And even the electronic health records themselves can trigger the next step and look at a list of resources. So we have been working behind the scenes to get this through. At this moment, it falls into the families to trigger, a appointment, and usually a dental appointment. And usually it will happen when something becomes acute, right? When they have pain, discomfort, a swelling, or something gets out of the ordinary. And usually when that happens, a lot of other things are already going on, and that acute episode is just the tip of the iceberg. So when the physician wants to do an oral health assessment, there are a few tools that they can use that have been already developed, not by us, but by other researchers that preceded us. Uh, but we also advocate that they can do a quick visual inspection. And if they see, visible decay, bleeding gums, mucosal lesions, broken dentures, visible plaque or debris, mobile teeth, or significant tooth loss without any type of prosthetic replacement, they can refer to a dentist themselves. Very easy, very quick. Nothing, it's not rocket science. Can be done by the medical assistants um, and other primary care providers with no much difficulty. Now, that's on the professional side of things, and as you guys know, we usually will use Medicaid for the care of persons with special healthcare needs. There is a huge discussion about Medicaid reimbursement and the and because we think, right, we think that because reimbursement is low, not a lot of dentists in private practice take Medicaid, reducing therefore the availability of services across the state, which end up being funneled to Iowa City, specifically to the College of Dentistry, which now has a waiting list. And we we have been working with other players across the state to see if we can change that game and have more people spread across the state that would be taking patients with special health care needs in their offices in order to reduce that concentration in Iowa City. Of course, I need to acknowledge here that we have wonderful providers across the state, like people in Broad Lawns, in Des Moines. We have we have a lot of community health centers that are taking patients with special healthcare needs, pediatric dentists that keep seeing their patients with special healthcare needs past the age of 18. And yeah, there's a lot of good things, but we still need to improve it. There are a lot of room for improvement. Now, when it comes to dental disease is for most part preventable, right? I mean, except when you have things like traumas and accidents, where people lose teeth and all that, which some may argue that part of it might be preventable by using mouth guards and things of that nature. Um, Most of the problems with the mouth are preventable because we have primarily two diseases: tooth decay, or we call it caries, and periodontal disease, which is diseases of the gum. Those are the two main oral diseases that we have oral cancer too, but then the frequency of that it reduces dramatically. By far the most frequent are tooth decay and periodontal disease that lead to tooth loss, right? That's the main problem. And those two are preventable. They can be prevented by having appropriate oral hygiene routines, controlled diet, and all that. And when we look at people with, lots of decay, lots of periodontal disease, such as the one on my first slide here, with a lot of decay, a lot of plaque, a lot of disease, that usually is not because of their teeth or because of, they were weak they have weak teeth, or they have, or because of their disease itself. It is because of the circumstances that surround that person. What I mean by that? I mean by that most people are able to keep their teeth for life nowadays because they do two main things. They brush their teeth, right, appropriately at least twice a day, in an effective manner, and they go to the dentist twice a year and have their teeth cleaned and have a good checkup, right? So why some people in younger age, or some after a few years, you know, get a lot of cavities, get a lot of decay, or get a lot of periodontal disease? Well, because one of those two things failed, right? They are either not doing their oral hygiene routines anymore, or not controlling their diet, because sugar, if you take sugar away, you take tooth decay away. For tooth decay to happen, you need to have sugar, right? Sugar comes in many forms, but you need to have sugar. Um, and the absence of preventive visits, because there are things that only the dentist is able to remove, or only the hygienist is able to remove. Okay, so why they get disease? Well, because they are not able to brush. People with special healthcare needs, they are not able to brush. Who is caring for them think they are, but they are not doing it effectively, right? Think the person with special needs is doing their own, it, his or her own oral hygiene routine, but that oral hygiene routine done by the person with special healthcare needs themselves is not efficient, right? So if we give Gabriel a toothbrush and tell him to brush, he will brush, but that brushing will not be efficient, right? So Adriana, my wife, goes there and brush his teeth every single time, right? And we do it after every meal. Now, she's a dentist. I'm a dentist. We are not expecting families to do that, although that would be ideal, right? And we control the amount of sugar. And if he has sugar, even in between meals, which we try to avoid, we'll give him a brush as well, right? Now, as I said, that's not realistic to expect it from all the families, but it would be relatively possible to do a nice brushing at night for them, right? Or at least supervise it, make sure they are brushing all teeth, all surfaces of the teeth, and that after brushing, it's clean, right? Having more fluoride is also good, right? For people with high risk for caries, because they are not able to efficiently brush and all that, we increase the amount of fluoride, and topical fluoride. And topical fluoride is very safe, right? Very safe in the dosages that we prescribe, right? A little small pea-sized amount of high fluoride toothpaste twice a day is safe, right? Radiation is not safe, right? We all know, but we do X-rays in a safely manner. We go to take a walk in the sun, getting a lot of radiation from the sun, and it's safe, right? So the dosage of it is really important, right? Same thing for fluoride. It's the dosage. So if we use it judiciously, properly, it gives phenomenal results on helping us controlling decay. Now, you might intervene and say, okay, you told that Gabriel is now in a good behavior phase. Now it's easy for you guys to do it. But how about when he was aggressive? Yeah, that was more challenging. And for those situations, we need to use behavioral challenges techniques, right? And they start with basic communication techniques that I'm sure you guys are familiar. So I'll not spend much time on this. So, be patient, respectful, and gentle. Use patient's name. Always smile, right? Because a smile breaks their fears, increase trust, and provides and gives them confidence, right? So always smile, keep eye contact, preferably at patient's eye level. Approach from the front, move slowly, introduce yourself, right? Use plain language and short sentences, like, you know, my name is Leo. I I am a dentist, and I am here to help you brush. Let's brush together, right? So short sentences, um, paused in a way that is as clear as possible. Provide only one instruction at a time, right? One sentence at a time. Briefly explain what you're doing and why you are doing it, why it's important. Repeat as necessary, and the repetition may give you a little bit of a rhythm too and help calm down the patient, right? If you are consistent. Be polite, provide encouragement and positive feedback, regardless, right? If you have a little small sliver of hope that the patient uh, move the head to the right side, even if it was an intentional, say, "Oh, thank you. It's much better now," and keep that engaging conversation going. Now, sometimes you need to use other techniques. One technique that is very helpful is to break down the task into small steps. So a very clear way to do that is when brushing, right? Instead of saying, please brush your teeth, which is kind of a lot if you think, one should say, hey, it's time to brush the teeth. Why don't you please get your toothbrush? And then they get the toothbrush, right? Now you say, please, now open your toothpaste. Perfect. That's great. That's your toothpaste. Now, add a small amount of toothpaste to the toothbrush. Yep, not that much, just a little less. Let's take a little off, and go about breaking it down to small little steps. Now, brush your front teeth. Then they brush their front teeth, right? Once you think that's good enough, then you say, now let's brush the back teeth on this side, and then brush the back teeth on the left side, then the right, then the right side, then the lower, then the up. You know, break it down to small steps, really small steps. And at the end, if you are using a regular toothpaste, say, now let's rinse. Great, rinse for a little more. Now good, spit off the excess. Yes, let's clean your lips. You're good now. We took all the bugs away, give positive reinforcement and all that. That helps a whole lot, especially for kids with autism. And then a communication technique, right? Um, sometimes Adriana is doing it and it's kind of difficult for her. He's being combative and all that. Then I enter the situation, right? I get there and say, hey, mom, let's that help now. And Adriana steps back, and I get into that. That change of environment, that change of person, change his reactions, right? Get him surprised. And that element of surprise might allow me to finish the task, right? Then I finish the task, and give compliments. Maybe even we can give a small little reward, like, access to a preferred item, or access to a preferred game, something that would make him happy, that he doesn't have all the time, right? um, and and help us moving along. The other thing that helps a lot is distraction, right? Distraction is a big one. I really like to use it. For Gabriel, it works a lot if we are talking his repetitive scenarios. He really likes to talk about, how the shark, um, uh, how he cannot swim at a shark's water, right? So he can't swim where in water that has sharks. And he repeats it over and over again and change it a little bit and say that he's now swimming with the dolphins. And then I say that it's okay. But then he says, no, no, it's the sharks. And then I say that's not okay. So if I engage him on that conversation, I can do pretty much whatever I want. That's the time when I can, brush his teeth for a longer period of time, can trim his nails, and because he's involved with it, he is into this. Um, for other kids or older adult or younger adults, it can be singing a favorite song or holding a favorite item, such as a blanket, a pillow, a doll. That works also for patients with dementia. Uh, Telling a story or a joke, right, by watching a favorite TV show, or engaged in any other appropriate favorite activity. And when I say appropriate here, it's not only appropriate in general terms, but it's also appropriate to the task you're doing, right? I mean, they cannot be playing their video game as you brush, because it's gonna get in the way of his eyesight, or will get in the way of his hand movements, and that can become a bother, and then he's gonna be linking brushing or doing whatever you are doing, rinsing, whatever, to a bother, right? And that, we don't want that link. We want the link to be a positive one. And then another one that helps a lot is bridging, right? We use that a lot with frail older adults. It works a lot also with adults with cognitive impairment, where we have the patient holding a toothbrush or any other care-related item, right? Can be whatever you have a spare, like can be a floss box, or it can be another toothbrush, can be whatever you prefer that is available, as we brush their teeth, right, with the other items. Why is that? Well, because they feel they are participating, right? And it brings memories of that activity and helps us doing it. It helps a lot. And we do that all the time. The other thing we can do to keep some autonomy, if, say, we want Gabriel to be able to brush on its own. I know it's probably not going to happen effectively, but we want him to do some. So we give the brush, and then he brush for a little while. Then we go hand over hand. We place our hands over his hand, and then we guide the brush. That helps also, and that makes him more engaged in the activity. I would always say that whenever you have a chance to give them an opportunity to engage with you in the activity, better, because we need to get that habit ingrained, because it really helps it in the future. All right, chaining. Another thing that we do is that a caregiver starts on an oral health care activity, right? we start it. I start brushing for Gabriel, do a lot of it or even all of it, but then I give him the brush and say, now you are going to finish it. Let's finish it big. And then he brushes a little more, even if it's not effective. I have already done it. So, but he feels that he's part of it, right? That he's finishing it. And without his finish, it's not going to be as good, right? So, and we keep, engaging him on that. So he can be a helper. And he does it. And it helps a lot. Now, um, we are going to go over one technique for brushing, but I want to let you guys know that we have a dental app that offers expert tips, from a group of dentists and hygienists on how to provide high quality oral health care for older adults. We have prepared it for older adults, but now it's available for and can be also used to adults with special healthcare needs and kids. It provides a lot of useful information. So it's very easy for you to use it. It's for free. You just type dental.aging.tips in any browser. It can be on your mobile phone, in your desktop, in a tablet, in a laptop, whatever. It works great. And you pop up and you have four main sections. Why oral health is important, how to provide daily care, how to overcome barriers to good care, and a session called What Should I Do If? And then there are the frequently asked questions, right? Should I do if I see broken teeth? What should I do if I gums are bleeding? What should I do if you know I I see a black spot in the mouth? You have it there for free. It doesn't cost anything. You don't need to download the app. The only thing we ask are two questions in the beginning. If you are a healthcare professional, if you're a family member, and the zip code so we can track where it has been used. That's it. Very easy. And in this app, you're going to find a lot of information that would be useful to you. So a person's teeth should be cleaned twice a day, ideally. Okay. We would say even that better than that is to brush after every meal. I brush after every meal. Um, when you are going to do that, have all the material you need to perform oral hygiene for the patient ready to use. So this was planned for a professional caregiver, say someone working in a group home, right? So then they need to have gloves, toothbrush, fluoride toothpaste, Dixie cups for rinsing and spitting, tongue depressors, gauze. Tongue depressors help you keeping the mouth open, the gauze, and prescription rinses if there are any, or prescription toothpaste if there are any. And now, here's the thing. In your home, of course, you may not use gloves to do it on your son or on your brother, sister. You may not use Dixie cups. You can do that right there on a sink. But you got the idea. Get everything you need. Have everything set to go because that helps you in the process. Right? So brush every and each patient tooth outside, top, and inside surfaces. That's very important. We have seen a lot of patients that just, as they are left alone for brushing, they just brush the outside. And then a lot of plaque is in the other surfaces and and decay develop on those surfaces that were not clean. So yeah, it doesn't help much, right? Use a pea-sized fluoride toothpaste amount only. For the outside surfaces, a 45-degree inclination. See that the toothbrush is inclined here, and it should touch the gum, right? Not only the tooth, but the gum. So it is placed in between the tooth and the gum to reach the region between the tooth and the gums, which is called the sulcus. There is a little bit of a groove there that needs to be cleaned very well. So a 45-degree inclination, right? Brush the top, right? The top, it can be right straight there, and brush the top with back and forth strokes. And that is, and we would say that it needs to be done in each surface for about 10 times, right? So it's back and forth about 10 times for good cleaning. Then for the inside surface, we are back to the 45-degree inclination at the gum line, right? Do the same thing. Incline the brush at a 45-degree inclination and have the brush touching both the tooth and the gums. So you are cleaning the margin between the tooth and the gum very well. And then for the front tooth, toothbrush should be positioned as shown, right? Also in a 45-degree inclination angle, touching both the teeth and the gums. And for the outside surfaces of the front teeth, use a 45-degree inclination so you reach that area between the tooth and the gum. Same thing for the lower front teeth, right? Make sure you take the lip apart. See that the person is taking the lip apart here and get it to clean in between the gum and the teeth on the lower teeth as well. For the inside of the front teeth, you have the toothbrush positioned like this, and that's when you kind of, throw some toothpaste into the mirror, right? Because you're doing this and it goes out. So you can do that with your mouth closed if you're doing it on yourself. But when you're doing it into another person, it's gonna make a little bit of a mess, and that's okay. Clean up later, but make sure you brush those areas too. Same thing for the lower front teeth. Just, have your toothbrush positioned this way and make sure you have about 10 back and forth strokes in each set of teeth, right? Because when you have the toothbrush there, it will clean about 2-3 teeth. So you need to move it from one teeth to another. And in each area, you should do about 10 back and forth strokes. So in order to make sure all surfaces are cleaned, you might establish a circular path, right? You do all outside surface from right to left on top and left to right on the lower one, right? So you follow a circular pattern. Then all inside surface from right to left on top and left to right on the lower one. So second circle. Then all top surface from right to left on top and left to right on the lower one. That's the third circle. After brushing, patient may spit the excess of toothpaste at the sink, and if patient's bedridden, in a Dixie cup. Some patients should be allowed to spit multiple times as saliva, foam, and debris might accumulate and make patients feel uncomfortable. So as you do it, first circle, spit. Second circle, spit. Third circle, spit, right? So that helps then control the flow of saliva, the amount of foam in their mouths, and make them feel more comfortable, right? Usually, most mouth rinses should be used after brushing the teeth for best results, right? So because you have removed the gusky and then it's now time to rinse, right? If your patient has a prescription toothpaste, usually it's a high fluoride toothpaste, please follow the specific instructions on the prescription because, it's very specific to the patient. Notably though, patients should not rinse after brushing if using a high fluoride toothpaste because you want that fluoride to stay for longer, right? And when you rinse it away. Have all the material you need to perform oral hygiene for the patient ready to use, right? For patients that can handle and are not stressed by the noise and vibration, a power toothbrush is recommended. It helps a lot. The caregiver to provide a nice, good brush and helps also patients with, manual dexterity, cognitive impairment to do the brushing as well. But what is tricky about power toothbrush is that people think it's going to do the job for you. Just put it in there and it's going to do it. It doesn't. You still need to do all three circles, right? On all three surfaces. And you need to do it slowly. So it has time to do about 10 circles in each area, right? To remove plaque effectively. So it's not magic. It's just a little mechanical help. That's all it is. Just a little mechanical help. All right. We are, getting close to the 10-minute mark, and I think it's a good time to stop so you guys can ask questions. And as I promised, here's my email that you guys can email me anytime that you want. Now, let me know if you want me to stop sharing so we can see each other a little larger, or just keep it there so people can see the email and take notes.
You can keep that on there so that they can see your email if that's okay. Dr.
That's
Marchini,
perfect.
yeah, you had talked about dentists that accept patients, special needs, broad lines. You said Des Moines community health clinics. Is there a way for families that are looking for a dentist that sees someone with autism to find those places?
No, we don't have it, put together in a nice little website or something. However, we are looking into this, and we hope that we will be able to put it together sooner rather than later. But at the moment, we don't have it yet. The problem with this type of thing is that it needs to be kept alive. That's where it gets tricky. So getting a snapshot, say, done today, 2 months from now, inevitably, you're going to have some changes on that already, right? So what we are thinking is to have a website centralized and try to use some artificial intelligence that can pull from the internet the bulk of the information, and then we will supervise it with our old-fashioned human intelligence and try to keep it updated. We have not, honed into a final model, but we have been working on it. So it's going to take a little while, I guess, still, but we're moving towards that direction. But that's a great question. Thank you.
Thank you. Another one is if a family has been referred to your clinic for wisdom teeth, can you talk a little bit about what that process is going to look like for a patient with autism?
Yeah, here in the college, if an adult with autism comes to us, to the geriatric and special needs, we are going to do the first exam. We are going to take the necessary x-rays, and then we are going to, if we can, at the same day, depending on the time of the day and the clinic, and the clinic patient output on that day, we would try to do a screening oral surgery immediately, same day. As they come to us, we bring them to oral surgery because they want to do their own stuff also. So they go and do it at the same day. And then we schedule for that extraction later. If the patient can tolerate an IV sedation, it would be done here in the college, and it's fine if no other important comorbidities are there. Now, worst case scenario, they would come, we will do the exam, and we'll schedule for another day to screen at oral surgery, and then they will schedule for the extraction. So three appointments, right? We try to avoid it, especially when patients come from afar. But it doesn't depend only on us. It depends on the availability of manpower, actually. So if available, we'll do it. If not, then we'll schedule for another day. That's that's how it works. I would say that is, chances are that we would be able to do both screenings at the same day, especially if it's a morning or early afternoon appointment. Majority of times we do, but I can't guarantee. So better safe than sorry. I would plan for 3 appointments to get extractions of wisdom teeth done here in the college. Does that answer your question, Chris?
Yeah, thank you.
That's okay.
Yeah. If anybody else has questions, you can either unmute and ask or put them in the Q&A.
Well, I have a question. Was the content kind of what you guys would like to have? Is there anything else you guys want to discuss?
Does anybody else have anything they want to discuss? If you want to put that in the Q&A or let us know, please do.
Okay, I'm not hearing any questions, so I think we were able to cover good ground today. I will be happy to come another day if you guys deem necessary, or if there's any other perspective of it that you guys want me to cover. Happy to do it. And do not hesitate to contact me directly if you have a question, or if you would like, if you are looking for someone in a specific area. I can't promise you that I will be able to figure that out, but I can promise you that I will do my best to figure that out. So we'll be a helper. Don't hesitate to contact me.
Oops, we have a question here.
Good.
What about if braces are needed? Is that a feature your clinic provides?
Our clinic doesn't, but the college does. So if the patient are able to comply, with a minimal accommodation, we would be able to refer to ortho, which is the department that does braces here in the college. They are great, but they are not special needs trained, right? So that's why I said if they require minimal accommodation, if it's, high functioning, that require a little behavioral accommodation, it's fine. Now, for someone like Gabriel, that will not be possible, right? I mean, he will not comply enough to sit on an orthodontic chair for the necessary time to have braces. And we also, placed the first appointment. And after that, for him to cope with, movement, pain, and tenderness, it will be really hard for him. So we look at the cost benefit of it. For Gabriel, he has a little bit of misalignment, but his bite is okay. He doesn't have pain or discomfort. It's not something that he's concerned about as far as his social interactions. So we decided as a family to leave it alone, right? But it could have been different. He could have a problem with it, or be willing to do it, or whatever. Then we would try that route. So the short answer is yes, but depends.
Thank you. And thank you also for sharing your story about Gabriel and having him be an example. We really appreciate that as well.
Oh, absolutely. I think, that's the way I can talk to this audience in a way that's more connected, right?
Mhm. Any other questions or any other information that you think would be helpful?
All these resources and the recording will be emailed out to all the registrants, so you can always review everything when you get it. And if you do have any questions, you can always reach out.
That sounds good. Isn't
Thank
it?
you,
That's
everybody.
great.
Yeah.
Yeah.
Thank you for
Thanks,
joining us
everybody. Thank
today.
you.
Yeah.
Well,
Thank you, Dr. Marchini.
thank you guys for having me today. I really appreciate this opportunity to talk to the group. You guys have a wonderful day.
You as well. We appreciate you
You
coming as
too.
well.
Thank you so much.
Thank you. Bye.
Bye.
Bye.